Undernutrition. Undernutrition is divided into three types: stunting, underweight, or wasting. Remember, what is meant by stunting is nothing but height for age less than minus 2 standard deviations is considered to be stunting. Underweight is weight for age less than minus 2 standard deviations, and wasting is weight for height less than minus 2 standard deviations is considered to be wasting. Okay, and moderate type of this undernutrition is nothing but minus 2 to minus 3 standard deviations, while severe type of undernutrition is considered to be less than even minus 3 standard deviations. Okay, then coming to the pathogenesis why this undernutrition occurs, as I've already told that there is a epidemiological triad that exists which is going to give rise to this undernutrition. That is, low birth weight babies are prone to get malnourished, and these malnourished children are prone to get infection, and this infected children are going to have low birth weight, and this kind of a cycle is always going to be present with the undernourished children. So there are two main entities in case of undernutrition. One is called as the Marasmus, and the second one is Kwashiorkor. Marasmic child is also called as is going to have an old man's face and baggy pants appearance. The description goes like this: that the child is going to have thin and lusterless hairs. The child will be having severe wasting, and the child becomes very irritable and hungry and has an anxious look with loss of buccal pad of fat, and temporal hollowing is also going to be present. There will be loose folds of skin over here. That's why it's called as baggy pants appearance. The criteria for diagnosing marasmus is that there should be no edema in the child, and there should be less than or equal to 60% weight for height of the child. That is, the child is severely wasted. The child is having severe wasting without any edema is considered to be marasmic child. And this child will be generally less than 1 year of age. Coming to Kwashiorkor, Kwashiorkor is generally seen in children who are 1 to 5 years of age, and the child is simply described as a fat sugar baby. And coming to some of the important criteria for diagnosing Kwashiorkor is, the first criteria is that the child will be having pitting edema with 80 to 60% weight for height will be present in the child. So let's discuss some of the various organ systems that become abnormal in a Kwashiorkor child. The first is about the hairs. Okay, the hairs will be dyspigmented. That is, there will be presence of dyskeratosis of hair will be present with depigmentation, desquamation, and hyperpigmentation of hair is also seen, and this is also called as flag sign will be present. Okay, which is nothing but alternate bands of hypo and hyperpigmentation. There will be what is called as petechiae, and peeling off of the skin will be present, and the child will be having angular stomatitis, and chelosis is also going to be present. The child will be having severe wasting of the muscles is also going to be present, not as much as marasmus, but there will be certainly wasting of the muscles in the child. And in the coming to the lymphatic system, there will be decreased immunity. When there is decreased immunity, certainly there will be child will be more prone for respiratory infections. The child might have tremors, there can be anemia, and the excretory function will be reduced. That is, the child might be having oliguria or anuria might be present in the child, and there will be stunting of the growth of the child. Coming to the WHO definition of protein energy malnutrition. According to the SAM guidelines, there are three most important criteria to diagnose protein energy malnutrition. The first is less than 3 standard deviations of weight for height. That's the first criteria that is going to be there. And then the second criteria is bilateral pedal edema should be present, and the MAC, that is mid-arm circumference of the child, is less than 11.5 centimeter. Then the child is considered to be having protein energy malnutrition. Some other important criteria include there will be presence of massive edema will be present. There can be diarrhea, pneumonia, dehydration, heart disease, etc. And there can be presence of IMCI danger signs in the child will also be present. So coming to management of the severely malnourished child, if the child is not having any complications of SAM, what are those complications? These are nothing but if the child is not having any loss of appetite, or hypoglycemia, or dehydration, or hypothermic shock, or toxic looking, or even if the child is not having any caretaker, it's better to manage the child in a hospital than going for a home treatment. So anyways, we will discuss first about the home treatment, then we'll go with the hospital treatment. In home treatment, what has to be started with is RUTO, that is ready to use therapeutic food should be given. Oil-based foods and animal proteins should be given to the child. And then for the medical line of management, amoxicillin should be given, vitamin A and albendazole should be given as a single dose. This vitamin A should be given 1 or 2 ml, and amoxicillin for 5 days it has to be given. And monitoring and support group, and finally physical activity of the child. And remember, the energy target for home management is 150 kilocalories. Protein target is more than or equal to 3 grams per kg. And the best way to measure the efficacy of treatment is by measuring the weight of the child. If there is weight gain, certainly the child is having good improvement in the treatment. Coming to hospital management, there are 10 steps involved in the hospital management. It can be divided into 2 stages. First is the stabilization stage, and then the second one is rehabilitation stage. Now, in the stabilization stage, it is going to last for 1 week, while the rehab stage is going to last from week 2 to week 6. There are 10 steps essentially. First is hypoglycemia. The child is considered to be hypoglycemic if the glucose levels are less than 54 mg per deciliter. Hypothermia is when the child has temperature of less than 35.5 degrees Celsius, and dehydration if the child has severe diarrhea, then the child is treated for dehydration. And fourth step will be the correction of the electrolyte. Fifth step will be removal of infection by giving antibiotics to the child, and then sixth step will be by micronutrients have to be supplied to the child, and seventh step is initiation of feeding by giving F75 diet. And then eighth step is catch up of the growth of the child by encouraging the child to take food in such a way that the energy target of 150 to 200 kilocalories per kg per day is achieved, and protein target of 4 to 6 grams per kg is achieved. And ninth step is by sensory stimulation, and finally the 10th step is preparing the child for the follow-up.